I have to gargle.
Okay. So, welcome everyone to our session for Mental Health Week today. We hope you've enjoyed the little bit of the pre-session chat, hearing us talk a bit about the topic. But we're expecting one panelist who is not in Canada, was hoping to connect, and we may still be joined by her yet. But if not, we're happy to have Councillor McKeen and Lorna Thomas here. To begin, I want to introduce myself. My name is Alex Aboud, and I work for CMHA Edmonton. To begin, and with the virtual session, and I can tell from some of the names logged on, we have people outside of the Edmonton area, but for our speakers today, at least we acknowledge all of us are gathered on Treaty 6 territory, a traditional meeting grounds, gathering place, and traveling route to the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. We acknowledge all the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. We thank you for joining us for today's event, which is a part of Mental Health Week. Now in its 70th year, CMHA Mental Health Week is marked across the country and aims to raise awareness about mental health concerns in our community and to empower all of us to do more. The theme is get real and to be in touch with your emotions. And you got a little bit of a window while waiting for this program to start into all of us being real. And we encourage you to, be real and be who you are and meet people where they are and where they're at every day, not just during Mental Health Week. We hope you'll be able to join us for some other sessions. Tomorrow at lunchtime, we'll be talking about what neighbors can do to support each other with the Edmonton Federation of Community Leagues and Abundant Community Edmonton. Right before that at 11, the Community Mental Health Action Plan will be hosting a webinar on brain health and science. Thursday, we have a panel on men's health and men's suicide. And on Friday, we have a conversation with the Alberta Esports Association about esports and mental health. A couple of things to note. You should see a Q&A button at the bottom center of your screen. Please submit any questions you might have there, and we'll get through as many of them as we can. And I do want to also note that we will likely be discussing sensitive content, and we acknowledge some of that may be triggering for attendees. If something is, and if you need support, at any time, but especially if something in this session brings up something for you, call our 24-hour distress line at 780-482-4357. We are thrilled to have Councillor McKeen with us today to share a few opening comments and facilitate the discussion. Councillor McKeen is the City Councillor for Ward 6, which spans across Edmonton's downtown area. He is a former journalist who covered City Hall and Edmonton's civic landscape for many years, and he is a longtime community volunteer. In some of his more formal roles, he volunteers with the Alberta Lieutenant Governor's Circle on Mental Health and Addiction and champions the City Council initiative Mental Health and Urban Isolation. More personally, he is a longtime advocate for mental health and a parent, which holds some relevance to today's webinar with Moms Stop the Harm, a network of parents and families advocating to change failed drug policies and the families affected by them. We are so pleased to have Councillor McKeen with us to open our webinar with a few comments, introduce our presenter, and facilitate some conversation after the presentation.
Alex, that was a lovely introduction. No surprise to me, having known you for a few years and know you as a real gentleman. So thank you for that. And thanks to all of you who have showed up here today. This is a real discussing drug use and opioids and the overdose crisis is a real passion of mine because I think we get so much of it wrong. And I'm hoping we learn a little bit more about that today, as I'm sure we will. This is relevant to me for a number of reasons, and I was trying to be open and honest and flawed, as we all are, when I joined council. And so I talked about my being a survivor of a teenage anxiety disorder, which led to depression and which led to self-medicating with alcohol. I'm now 14 years sober. And so that's a big part of my life. And so the opioid crisis really resonated with me. And so name it, don't numb it is a really nice slogan for the things I had to learn over all those years. So, Alex described this theme leading up to this event. It's an invitation to come as you are, talk about how you're feeling, and make it safe for others to do the same. Having been at hundreds of 12-step meetings, tell you what I think is the most powerful aspect of those meetings is to be able to be yourself in a loving, non-judgmental room, and then developing a community around that. And so there are a lot of people suffering in our society and we just don't know it. That has to change. Last year in 2020, a year like no other for people of our generation, 1,128 Albertans died from an opioid overdose. 1,128 people. That's the highest number of people ever in our province. It's almost double the number of deaths in 2019. But it isn't even the number that I want to focus on. It's the people. Every one of those people was a child to someone. I'm sure many of them were parents, siblings, and friends as well. We need to be talking about the people and their experiences. We need to be talking with people about their experiences. It's through listening and talking that we learn, find ways to do things differently, and ultimately save lives. That is why I am so pleased to have Lorna Thomas here today. She is one of the 3 founders of Mums Stop the Harm. This topic is all too real for Lorna, who lost her son to this dreaded hidden epidemic. These 3 women who started this are passionate, dedicated, and very much to their credit, effective advocates for drug policy reform. If some of you heard any of us in the opening, I just think having moms stand up on a cause is such a powerful, powerful thing, because moms are a symbol of goodness in the world for good reason. But I'm so grateful that Lorna and her 2, hundreds of others, I think it is, across the country are leading conversations that help people, including people like me, learn and see things differently. I am going to start now. I don't think Petra has shown up yet. Am I right, Alex? Can you confirm?
Yeah, correct.
Okay, so we were going to have Petra. Petra's in Germany. I've met Petra a number of times in her advocacy before City Council. She's a fantastic advocate on this issue, but her colleague, and equally, if not more fantastic, is Lorna. So Lorna, I just want to say that no parent should ever have to go through what you've gone through. But that's why we're here. And one thing I wanted to share, that it was a time when I was against decriminalizing drugs. And I changed my mind, and I changed my mind because of Mums Stop the Harm. And these issues, it was just further evidence to me that these issues are not black and white. They're very nuanced and very subtle. So thanks to you for changing my mind on that. So, and I hope it helps other people realize that it's okay to change your mind on public policy. I've lived the stigma of drink, and I've heard the stories of people coping with life through drug use. People living with substance abuse challenges need support and compassion. They need us to look at substance abuse as an illness and treat it that way. And I can tell you, over the weekend, I had my first experience in memory of opioids. I was injected with hydromorphone because of back spasms that developed just after lunchtime on Sunday, and I ended up in ER whimpering like a baby. I can tell you it was one of the most painful experiences I ever had. And that hydromorphone quietened down all that shooting pain. So on Sunday, I was a big fan of opioids. And opioids are used by thousands of Albertans all the time for legitimate pain reasons. But then we would say, oh, but then there are people using them for illegitimate reasons to get high. That is not a simple dichotomy. Pain is pain is pain. And Dr. Gabor Mate, when asked about why people use drugs, his one-word answer was pain. Pain can be more psychological than physical, more physical than psychological. People will scramble and do anything they can to get relief from pain. Thus why we have drugs being used by people. And why we have this overdose crisis. And Lorna, I'm going to stop there and ask you to jump in with not one, but two presentations, I gather. So please go ahead.
All right. Thank you, Scott. And thank you, Alex, and the Canadian Mental Health Association for organizing all the presentations this week. I think during the pandemic, we need this kind of help more than ever. Last night I was listening to CBC News, and they referenced a word that describes where we are right now. And the word they used was languishing. The people are languishing. So if this has meaning for you, I really hope that you find connection and support and purpose in your life. And for me, I find that doing volunteer work with Mums Stop the Harm around the drug crisis helps me to have purpose. So I'm going to do my best to navigate Petra Schulz's PowerPoint, which I haven't looked at that carefully. You're going to see her presenter notes because I need to read them. So here we go. And then I may not do all of her slides, and then I'll segue into my presentation. So here we go. All right. And I hope that I'm sure she's okay. I know living in Germany, where she is, they sometimes are having problems with reception, Wi-Fi reception. So here we are. It's the Canadian Mental Health Association Mental Health Week, and we are part of this family panel on substance use and mental health. I'm going to be sharing some part of our son's story. And so why we're sharing our stories is that much of what's happening in terms of the rules, the laws, the actions, policy and practice are not based on evidence. There's a lot of stigma, and it's hard for people to speak out. Many different organizations are helping to change the narrative and evoke empathy with you, the public, politicians, and policymakers. So our painful stories are opening hearts and opening minds. This is Danny. This is Petra's son. He worked in the culinary arts and died of, we call it an opioid poisoning in 2014, just as the crisis was beginning, where drugs were being contaminated with fentanyl. We now have more than 2,000 people in our group. Petra and I and Leslie McBain started it so that families could come together and support one another. Substance use and overdose can affect anyone. And
Sure.
here,
Lorna, I don't believe we've got a couple notes from the attendees. The screen is not being shared at the moment.
oh, really?
Yeah.
I thought I did the screen share. Weird. Okay, here we go. My apologies.
Oh, we're good now. Thank you.
There.
Yeah.
All right, thank you very much. So if you look carefully at the faces of these young people, they're only a small representation of the many, many people who have died by substance use and overdose. And it can affect anyone. As you see, it's people from all socioeconomic, ethnic, cultural backgrounds, and all are affected across the country. But there is one demographic that's most at risk, and it's men ages 25 to 39 using alone. Mostly they're using indoors. I know we see a lot of pictures of needles on the streets, but here in Edmonton, of those who died by overdose last year, 70% were in their own home. And why people use can vary, but often, as Scott said, it's physical, mental pain, trauma, adverse childhood experiences, a lack of hope, and also mental health issues. You'll notice that we haven't been, we're using language differently now. We encourage you strongly to use different language. So people in recovery, drug use, people who use drugs, people with substance use disorder. These are neutral terms, and it's people first language. So we really encourage that change when you're speaking about people that you're encountering. I met Petra here in Edmonton, and then we met Leslie McBain, who was from Edmonton, now living in BC. 3 of us started Mum Stop the Harm 5 years ago. There's now more than 2,000. Since this slide, we've had more people join. So 2,000 families that have been impacted, and we advocate for an end to substance use related stigma, harms, and death. We use a family central approach. So we're targeting families to improve outcomes for family members whose loved ones are using, and hopefully, excuse me, result in better addiction treatment and outcomes and prevent adolescent substance use. So if you have a concern, here are some tips. And as I understand it, this session is being recorded. So speak to the person about your concerns, be calm, factual. Don't make your support conditions on ending substance use. Prepare and respond without judgment. And don't assume that person will never use substance again. We heard recently that people can go into treatment 5 times, and maybe it'll take even more attempts to be able to recover. And recovery looks different for everybody. We're also really doing our best to focus on youth and substances and access to harm reduction and classes that tell people what the drugs are that are out there. We say, rather than just say no to drugs, just say no, K-N-O-W, know your drugs. Dead people don't recover. So we want people to carry naloxone. You can get it for free at any pharmacy without judgment. We've been doing our best to engage in advocacy, provide peer support. We have healing hearts groups for those who have lost loved ones to substance use. And we're out on the streets doing our best to change policy. What we're mostly advocating for at this time is a safer, legally regulated supply, and Scott can probably talk about that a little bit later. Decriminalization of the people who use drugs, so people would not be arrested if they're carrying small amounts of drugs for personal use. We want evidence-based treatment, including opioid agonist therapy, so Suboxone, methadone, and so on. We want upstream prevention rather than after the fact response. And we want inclusion of people who use drugs and the people who love them. So that's Petra. I hope I did Petra some justice with that. As I say, I had only seen it about 10 minutes before. So I'm going to segue into my presentation. So this is our son, Alex. Shortly before he died. He was 24 years old when he passed away. He had graduated from Vic School with honors. He was sensitive, very friendly boy. After high school, he decided to answer the call and promise of making big money in Alberta's oil and gas industry. He turned down the opportunity to go to university and trained for 6 months, then took a couple of years off, moving to Banff to snowboard, work in the service industry, party, enjoying cannabis and alcohol recreationally. When he returned to Edmonton to study at NAIT, he was the top of his class. When he completed his apprenticeship, he began working long hours as a welder in a fabrication shop, working more than 60 hours a week. He became depressed behind his protective welding mask. Like many young adults, Alex did not want to talk about mental health. And in 2012, he died. Okay, what's going on? Why am I not going to the next screen? Ah. I'm just going to change the view here to my notes page. No. Sorry, a little thrown off by doing 2 PowerPoints rather than 1. So after Alex died, I was shocked to find out that he had been using stimulants, cocaine and methamphetamine, to help him cope with the depression and intense work schedule. Edmonton has a methamphetamine crisis just as we have an opioid crisis, and it is directly linked to the opioid crisis. In 2019, 80% of Albertans who died by an opioid overdose had another drug in their system. Half the time it was meth. Meth makes users feel very good, offering a rush of energy, self-confidence, and it helps people stay alert. I believe that Alex used these stimulants to help him keep.
Lorna, I think you're muted.
Okay, sorry.
No, there you go.
All right, thank you for telling me. So as far as I know, Alex was using cocaine more than meth. I did see some of these signs, but I didn't connect the dots. In particular, I noticed that he had been losing weight. And also he said that he would sometimes stay up, for all night on the weekends, but I didn't know the signs were an indication of substance use. So I was seeking some way to help others and found out about a program developed in Grand Prairie called Tough Enough to Talk About It. It helps people in the trades to recognize and address mental health and substance use issues and promote suicide awareness through workplace or schooling presentations. So I went to NAIT, where our son had studied, and brought the program to them. And so now instructors at NAIT have received training to deliver the program. And my husband, Phil Haig, and I deliver the program as volunteers. We've been doing this over the last 6 years. Now it's being delivered online, which is providing some interesting access to people so they could maybe take a lunch break, sit in their car, and watch the videos about men who struggled with mental health and substance use and how they recovered. People working in the trades face many challenges. Here's a list of some of them. The ones I think that affected Alex the most was the isolation, working such long hours, not being close to his friends, and working nights. It was very hard on him. And people in the trades and construction are more likely to die by substance use than any other profession, including opioid overdose. So I encourage parents, workers, and employers and employees to access available resources. There's more out there now since the drug crisis has been accelerating. So on our Mom Stop the Harm website, we have resources for various provinces. So I think that this is probably one of the more important advocacy initiatives I've been involved with this year. On the right, you see our former Minister of Trade and now Minister of Health, Patty Hadju. Her son is training to be a crane operator. She has hosted 2 ministerial roundtable meetings, and I was honored to be invited as a representative of Mom Stop the Harm. The discussion with the group has focused on actions that could be taken to address the disproportionate harms experienced by men employed in the trades. And based on those discussions, Health Canada is now developing a toolkit of resources targeting young men in the trades, but also talking with administration, what's going on with occupational health and safety rules that's contributing to these harms. Another advocacy initiative I participated in recently was speaking to a motion put forward by Councillor McKeen. The motion addresses the opioid crisis, and he'll tell you a bit more about that shortly. Recently, I've been working with others to develop video resources. I'm a filmmaker by profession. And so I'm going to end my presentation with a short video. I worked with another Mum Stop the Harm member, Amy Graves, and we used TikTok to share a message about harm reduction. Amy lost.
Lorna, sorry to interrupt. We're getting some notes again that screen sharing appears to have stopped for some or frozen for some attendees. So
okay,
if we
all
could,
right.
And also we'll see if we can, with your consent, we'll share the presentation just for attendees who weren't able to see all of it.
Okay, all right. Let's end with this video then. Can you see that? Yes?
No video yet.
Canada, listen up.
Yeah, no video.
It's called the opioid crisis, and it's killed almost 18,000 Canadians since
That's so
2016.
weird.
3 out of 4 opioid overdoses.
I'm not sure why. It says I'm screen sharing.
Yeah, well, I could hear the audio but not see the video.
Is it your settings perhaps?
Great question. I'm not sure.
Can you see it?
Oh, yeah.
Okay, here we go.
Hey Canada, listen up. We got a big problem here. It's called the opioid crisis, and it's killed almost 18,000 Canadians since 2016. 3 out of 4 opioid overdoses in Canada are men, and often they're dying at home alone. Construction workers are 6 times more likely to die of an opioid overdose than any other industry. Injuries on the job in construction are quite common, and often the toxic masculinity in these industries prevent people from talking about their pain. And how can we prevent opioid overdose deaths? Don't use alone. Carry naloxone. Keep your doors open. Use the Good Samaritan 911 law if you see someone in medical distress. Call an overdose prevention hotline before using. If we don't properly address the opioid overdose crisis, we don't only lose our loved ones, we lose an entire workforce.
All right.
Thanks, Lorna. That's powerful, and that's a powerful message because it doesn't say stop using. That's not the first part of it. Lorna, thank you very much. I think the world of you, and you're doing such important work. You mentioned my motion, and I'll go through that quickly. Just give you a rough idea of what the motion did. The motion asked for the mayor to write a letter to the federal government declaring the opioid crisis a national health emergency. It asked for help from Ottawa to help establish and fund what's commonly known as safe supply program in Edmonton. I took those words out because they trigger some people in the provincial government. And so I took those words out and used different words. I think it was pharmaceutical replacements for illegal street drugs instead of safe supply. And then the other part of the motion was asking the provincial government, we're opening 5 supportive housing units in early 2022. And they talk about therapeutic communities, which would be long-term treatment. And so just to see if the provincial government would look at funding our supportive housing facilities as therapeutic communities with safe supply. Because right now we're opening these 5 supportive housing facilities with help of the federal government, but no operating dollars from the provincial government, which is a huge problem for us at the city. I would argue that the Iveson Council has done a ton of work around looking after our most vulnerable people who live on the street largely. But you know, this is so confounding, this 70% of opioid issues being people using alone. Lorna, why Why do you think there's so much shame and stigma around this? Have you guys talked about it or thought about the historic underpinnings for our the way we look at quote unquote addicts or junkies?
Well, I won't get into the history too much, other than to say that the war on drugs began really as a way to, in the United States anyway, to keep Black people down, you know, to really find reasons to incarcerate, find reasons to separate them from their families. It really, when you look at what was going on in the US in the 70s, there was a lot of turmoil politically. And so it became a way to have one group rise up and another keep another group down. And that happened here in Canada as well, of course, with all that we now are learning. And unfortunately, the incarceration rates of our First Nations people is much higher. And again, I think it was all part of colonization, is let's just keep these people down and we're going to move in and take over. So that's kind of a very broad brush stroke. But I think also it was the way that we were taught, the way that we were brought up with the just say no to drugs implies that people who are using drugs are bad people. And we know that's not true. We know that people have a glass of wine. I mean, look at our city. We just are approving safe consumption sites in our parks. We've just approved how many sites where we can now go and drink wine. So it's all a matter of changing our headspace. And we really don't want to use the word addict anymore. My brother's a person with a disability, and he taught me about the importance of person first language. So we talk about people who use drugs, and we let the other language go.
Yeah, I actually have a blog post I'll be putting up fairly soon on language, because as a former journalist, I hated having to write 6 words for 1 word. But I've become more and more aware of the complexities of all of this, and recognizing that we need to give people dignity, the dignity of being a human being first, who has some issue or disability. And the disabilities behind addiction are really complex. But I think the other thing that's really complex and hard for me to see as a 62-year-old man raised in this culture are all the underpinnings or the framework of colonialism and how that impacts issues like this. And I think it's something that you're helping us, you will help us to learn through MOMS, Stop the Harm. What's next on your agenda for MOMS?
Well, for me personally, I'm working with the community action team in White Rock, Surrey, and we're doing a video for people in the trades and not just the workers. I think a lot of the materials that have been developed put the responsibility solely on the shoulders of the worker, whereas actually they're often dealing with unmanageable work conditions. And so the video will look at administrators working in various trades and construction, as well as the workers, so that we can get a good sense on what's really going on, what needs to change. And so continuing to work at the federal level with the ministerial roundtable, the after fact of that, and then developing this video project. So I'm kind of in this niche of people who work in the trades. And as far as the larger picture for Moms Stop the Harm, we continue to advocate for the things I discussed earlier. And, August 31st, Overdose Awareness Day is coming up. So we'll be now just starting to plan a provincial and perhaps a national advocacy event to help people understand what's going on, to say this is the other pandemic that we're dealing with, and it's just getting worse. And look at how different provinces are reacting to the crisis, because different provinces are handling it in different ways, and some are having better success than others. So let's learn from one another.
So when I talked to you recently, Lorna and I had about an hour-long chat after the motion. By the way, passed through council, it was divided in two. One aspect passed 12 to 1 and the other 11 to 2, I think, if memory serves. So we got broad support on council. It's a pragmatic thing. Do you not think, Lorna? Preventing death is a pragmatic thing. We have to get our philosophy, ideology, so the way we've been socialized, we got to get that out of our heads.
Absolutely. And I really thank you very much for bringing that motion to City Council. Similar motions have been put and resolutions have been put to city councils and communities across the country. I think we have more than 40 communities now that have responded, basically sending a message to the federal government saying, let's call this a national health emergency. Let's decriminalize. Let's look at alternative safe supply medication, hydromorphone, medication that'll keep people alive while they're seeking new, I guess, treatment options and new means towards recovery.
We have a question from Beth. Thanks for sharing. My eyesight is not the greatest, but my question is, when we have a loved one dealing with substance use issues, how do we balance supporting them with enabling life-threatening decisions? If offering information and sports is not welcome at the time in their life, what can we do to support them?
I think the phrase that I hear more often than not is, rather than tough love, true love. You never stop that love from coming forward. You try and stay connected as best you can and keep yourself well. There are lots of different groups online for parents supporting parents. We have, if you become a member of Mom Stop the Harm, we have a closed Facebook group for parents and siblings, people that are, people that are dealing with their parents. And it's an online group, it's a private group, so people can ask those kinds of questions, and those who are in the middle of it can support each other. So, the link to Mom Stop the Harm is there. And I think just stay connected with your loved one as best you can. Obviously, you want to keep yourself safe at the same time. But finding others to communicate with, I think, is the best advice. I also see a question about the organization working with trades and construction. The one that I referenced is the Suicide Prevention Resource Center in Grand Prairie. I'll put their website in the chat. And the community action team in Langley, in White Rock and Surrey, they're not engaging with the public quite yet, but they will be soon. So we'll be having updates around that initiative on the website. I'll just look for that website for the Resource Prevention Center.
Well, you're looking that up, Lorna. I can tell Beth, I think it was Beth, from a 12-step point of view, and I heard this many times, saying to somebody, I love you, but I'm concerned about your drinking or your substance use. I'm concerned about it because you love them. And that, I heard, was from a number of people, somebody doing that to them then became a bit of an earworm that wasn't so easy to get rid of. So rather than shaming, blaming, yelling, it was that expression of love. Authentic love to somebody, but along with, I'm concerned about what you're doing to yourself, and an offer of help with that. Is there an equivalent to Al-Anon for opioids? Do you know? Al-Anon might work for anybody, but I've attended their meetings, and that's about loving the other person, but protecting yourself too. Making sure that you're healthy and whole.
Okay, I just found the resource center. Tough enough to talk about it.
And I see in the chat that Anna Maria has noted Naranon as well.
Okay.
So Lorna, while you're looking that up, I see we have a question for Councillor McKeen. That's from the perspective of someone who is a politician. How can advocates change the minds of those politicians who are so entrenched in their personal ideology that they ignore the research evidence that supports harm reduction.
You're talking about the provincial government.
Yes.
Yeah, it's a really tricky one. And I even saw that on council, there was a couple of councillors who, I think in one case, it just did not fit their ideology to support harm reduction. In the other case, I think it was political in the sense of they didn't want to associate themselves with something controversial with a fall election coming up. I think I think we have to take it to the base. Take it to the base. And Lorna, something I want to talk to you further about at some point. We need to get to those religious organizations out there, which often are the base, because I've heard that when you present the information in the right way, that some of the more conservative religious organizations will even come around. Like I said, I got a shot of hydromorphone on the weekend, and there was no stigma with that. Like, and could we use hydromorphone for people who are addicted on opioids as a way to transition them to a more recovery and more sobriety? But that's what this is to me. It's like a pragmatic response. And we prescribe opioids, but we say your pain is not equivalent to their pain, so no, you don't get any. To me, that is ridiculous. So I think it's talking to your MLA. In Edmonton, the vast majority of our MLAs are probably on side. They're New Democrats. Casey Madhu, the Justice Minister, I suspect you'd run into a brick wall. But maybe if we keep putting in rather than shaming and blaming them and yelling at them, maybe it's an invitation to be with kindness and compassion for their position. Say, I'd like to talk to you about this. Is really important to me, especially for people who live in his riding. Say, I'd really like to talk to you about this because we got too many people dying. Yeah.
I was just going to say, I think what you say about changing your mind is okay. I heard somebody on television the other night say, I didn't believe in COVID, but then my friend got terribly sick and is a long hauler with COVID, and I changed my mind. So I think giving permission to people to change their mind and, making your best case, and also voting as if your life depended on it. Whether it's harm reduction policy that you're supporting, or whether it's evidence-based medical treatment for COVID-19. I think all of us as citizens do need to get involved, because I think between the two pandemics, the opioid crisis and COVID-19, we realize how important it is that we have people in public office that are really going to do their best to keep us safe. So yeah, I guess start campaigning now.
Well, and I think I just was starting to listen to a podcast this morning, Sam Harris's Waking Up podcast, and it was with a researcher who looks at culture and its invisible influence on all of us. And they were talking about COVID, and even though in the US more conservatives tend to be more sensitive to threat, they had the great leader tell them it wasn't a threat, and they tend to be pretty attuned to authority. So we've got to get our leaders to start to change their language. And Jason Kenney has said a couple of times, we don't believe in giving drugs to drug addicts. And that's really potent language.
But it goes against evidence. The evidence shows that the best treatment for opioid dependence is opioid agonist therapy. Get people on Suboxone immediately. A rapid response will save lives. And so I think that, making sure that you're basing your decisions for yourself and your loved one on that evidence is very important. I also see a note here to look at getting doctors not to prescribe OxyContin so easily, or different opioids. I think that's definitely happening. There's actually an initiative this week that's launching called Prioritize Pain. So it's looking at pain, looking at ways to to deal with pain that won't require lead a person down the path of opioid dependency. So keep your eye out for that initiative. But there's a lot of work that needs to be done. So I see all of you there who are on the call staying with us. I'm so impressed you stayed with us, even though my hiccups with technology, but I really appreciate you being here and contributing to the conversation.
I left emergency room the other day with 4 Percocet, 4. So that was not an over subscribing in that case. I've only used 1. Alex, I want to thank you and Lorna for this. And the Canadian Mental Health Association does amazing work in the background all the time. So thank you so much for inviting me and Lorna to this today. I understand you probably have some closing comments, so I'll flip it back to you. Thanks, Alex. Thanks, Lorna.
Well, I'll be brief. And I want to, first of all, thank everybody for attending today. And apologies, we weren't able to get through all the Q&A, but I think that's it's a side effect of what was a really stimulating conversation. And we could probably have gone another hour, and maybe we'll do this again another time. So I want to thank you both, Councillor McKeen, and thank you, Lorna, to you and your colleagues for all the work that you do, and for moving this important issue front and center. And we know that there's a link, such a strong link between mental health and substance use. Sorry, this is we're all unlearning decades in some cases of inappropriate or language to describe situations. And so maybe this is one of these examples where you give someone grace to change, that we're all gonna slip up sometimes. But yes, we know that's a link, and we see it amongst the people we're trying to support. So thank you. Thank you to everyone, both of you, for your contributions, and we hope you all have a great rest of your day and can join us again throughout Mental Health Week and in the future.
Thank you.
Thanks, Alex. Thanks, Lorna. Thanks.